Did you know that you can have a normal delivery even after a cesarean section? By now, I've found most women asking themselves why they were rushed to the theater immediately after reaching the hospital. Today in this video, we are discussing about the indications of a cesarean section. Why is it inevitable sometimes for you to have a cesarean delivery, and also the complications and how you can deliver again normally even after a cesarean section.
Ask Dr. Othman on Sawa Wall.
Hello my very good viewers, welcome to Ask Dr. Othman YouTube channel, a channel where I learn medicine at the comfort of your living room. I told you if you'd like to get in touch with me to have a private chat, a private conversation, go to my website www.drothman.com, book an appointment. I will be right there to answer you. And for those of you who would like to become members of this channel, please press that join button, become a member. And if you're watching this video for the very first time, please don't forget to subscribe and also press the notification bell in order to be notified of any important videos. Do not forget that on every Thursday at 7 p.m. or 19 hours East African time, we are always having a live program where we have a Q&A. You ask a question, I answer you. Today we are talking about something very, very serious and something of a very big clinical importance. It has a clinical importance, it has a psychological importance, and a sociological importance. And therefore, call your neighbors, send this video to everyone so that they can benefit. We are talking about a cesarean section. Why are we talking about cesarean sections? Because most of you go to the hospitals. When you're pregnant, you feel like you've reached your time for delivery, you go to the hospital, hoping that you are going to deliver normally. The bad news you get is that you can't deliver normally. We are taking you to the theater, and then you start palpitations, start thinking about a lot of things. What happened to me? Some people even think about witchcraft. Witchcraft. If you have, if your spouse has two women, then you think about many other things. But why are these cesarean sections done? That's what we are going to look at. First of all, a cesarean section is a procedure. It's a procedure whereby you cut or you make an incision, a simple incision on your belly. We make an incision on your belly, just below the umbilicus. We make that very good, very nice, good incision, and then we pass through the layers of the abdomen, because the abdomen has many layers. So we pass through all of them very well, with a sharp knife, very well, dissecting very well. Then after, we reach the uterus and also make a lower segment incision. So when we make that lower segment incision, we are able to pull out the baby, and then the rest is history. So that is what we call the cesarean section. Someone would wonder, why would a woman be taken to the theater for cesarean section? Why would a child deliver normally? Now we shall classify the reasons for doing a cesarean section into three phases. Number one will be the fetal causes or fetal indications. Then number three will be the maternal indications. And number four will be those emergence cases. Number three will be the uterine cases or uterine indications. So by fetal indications, we mean that this is a condition happening on the fetus, on the baby in the womb, and that condition that is happening on this baby cannot let us do a normal vaginal delivery. For maternal conditions, these are conditions happening on the mother, on the woman. The baby is fine, but the mother has conditions that cannot enable her to deliver normally. And then we have the uterine conditions, whereby the mother is okay, the baby is okay, but the uterus has its issues. And this is what we are going to look at. So straight away to the fetal conditions, or the status of the fetus, of the baby in the womb. We have what we call fetal distress. By distress, we mean the baby is not feeling okay. The baby's breathing has lowered. The baby's heart rate has lowered. The baby is sick. If we wait further, this baby may die. You reach to the hospital, your plan was to have a normal delivery, but after an obstetric examination, The doctor finds out that the baby's heart rate is reducing. The baby's breathing, the movements the baby is already having meconium is stained. So with those conditions, the doctor will decide for a cesarean section. And that is one of the reasons why a cesarean section has to be done. And by the way, to the mother, when the doctor tells you that the baby is distressed, we are planning for a cesarean section, please never hesitate. Never hesitate. Just mold yourself, talk to your spouse, and just allow the procedure to be done. Another fetal condition is called the cord prolapse. By cord prolapse, we mean the umbilical cord. Okay? The umbilicus has, in a layman's language, you can say it has fallen down. In other words, when someone puts the fingers there, okay, when we are checking the baby, you find that you are able to palpate the cord. It's the cord which is presenting, and it has also gone down. That condition is also detrimental to the baby, and the baby will get distressed. The baby may end up dying. And therefore, when we see a cord prolapse, theater, cesarean section. Another fetal condition is the malpresentation. Malpresentation, mallies, and so on. What do we mean by malpresentation? Normally, during labor, the baby is supposed to present with the head. Cephalic presentation. Time comes when the baby is presenting in a breech way, is presenting with a buttock. It's the bum that is presenting. In other words, because you see, this is the pelvic region, this is the cervix. The baby is supposed to come with the head, and instead of bringing the head, the baby is bringing the bum. The bum is one of the most difficult items to pass through that pelvis. Okay? Then sometimes the baby will begin with a leg, or at times the baby, instead of bringing the head from this part, the baby is bringing the face. So those presentations may make it impossible for someone to deliver normally, and therefore you may go for cesarean section. Another condition is macrosomia. What do we mean by macrosomia? Macrosomia will mean big babies. Okay, someone you're pregnant, but the baby is very big, and for big babies you're talking about 3.5 kilograms and above. Of course, someone will tell me that me have delivered a 5 kilogram baby. Yes, it's okay, it's possible, and we've seen those cases. Normal deliveries of 5 kilograms, even up to 6 kilograms. But in most cases, macrosomia, all those big babies, especially babies with big heads, they may not be able to pass through that pelvis for that woman, and therefore may require a cesarean section. Also, congenital abnormalities. There are some babies that have congenital abnormalities. What do I mean by congenital abnormalities? For example, the one we talked about, a big head, you find someone has a mass somewhere, has a swelling or something somewhere. Those congenital abnormalities can make a woman fail to deliver normally, and may go for a cesarean section. Then, we can also have prior neonatal birth trauma. By the way, you find that this woman, the first pregnancy, the baby had trauma. Okay, when the baby was being delivered. Even the second pregnancy, the baby had trauma, was traumatized. Okay, during delivery. Then we can think about planning for a cesarean section. Then, failed operative delivery. What do you mean by failed operative delivery? You've been in labor, okay, and they have tried to use instruments to get out the baby, and the baby has failed to get out. Then we may request for a cesarean section. Those conditions I've talked about are fetal. They are for the baby. Now, let's look at the maternal conditions. Conditions affecting the woman, the mother. Conditions affecting the mother that are making the mother fail to deliver normally. Number one is previous cesarean deliveries, 2 previous cesarean deliveries. Actually, let me tell you women, if you've had 2 cesarean sections, you are not supposed to attempt a vaginal delivery or a normal delivery. If it's 2 previous scars, if it's one, we shall see it next there. We shall see how you can do a VBAC, what we call a VBAC, vaginal birth after cesarean section. You can do that if it's one scissor. But if it's more than 2 scissors, then you are not allowed to try vaginal delivery. Then, distress, maternal distress. You see, we've been talking about the baby being weak, the heart rate is going down, the breathing, whatever is going down, and even when it happens to the mother enters labor and she gets distressed. She has no energy. You try giving glucose, you try giving whatever you can, but the mother is very weak. She cannot push this baby. Then that will be an indication of a cesarean section. Then there are also what we call maternal requests. Now these are allowed, or these are legal in some countries but illegal in other countries, where a mother comes and tells you, I do not want to have a vaginal delivery. Now you want a cesarean section straight away, and some countries allow, others do not allow, but that is an indication of a cesarean section. We also have what we call pelvic deformities. Okay, pelvic deformities or sexual pelvic disproportionality. Like you find that the pelvis is, for example, there are some women who have inadequate pelvises. Like the pelvis is small. Okay, there are some pelvises that have ischospines that are at an acute angle. How am I going to explain this? You see, when you look at the woman's pelvis, if it's like this, in the pelvis there is what they call the ischospine. There are some small bones around here. One is here and another one is here. Those bones are supposed to be a little bit, they're not supposed to be curved, they're not supposed to be sharp, they're supposed to be a little bit curved in this angle, around 60 there, 45. But you find that someone has a bone that is that is perpendicular at 90 degrees. Okay, they are sharp, the ischospines are sharp. That woman may not be able to deliver normally. And then we have previous perineal trauma. Okay, maybe you had damages to your perineum, damages to the perineum, damages to all those that area. Then it can indicate you to have a cesarean section. Then cardiopulmonary diseases. Cardiopulmonary diseases. A woman has a heart disease, has a severe life-threatening pulmonary disease, a lung disease. Then we cannot take that woman, we cannot allow that woman to have a normal vaginal delivery because it is stressful. Therefore, we shall take this woman for a cesarean section. Women who have HIV and HSV. Now, this is a relative indication, and it is also in some countries, if you have HIV, then it becomes an indication, a clear indication of a cesarean section. But in some countries, they say no, this woman can deliver normally. Then cerebral aneurysms. If a woman has cerebral aneurysms, when there is a swelling on a blood vessel. So you find that a woman has a blood vessel in the brain, in the head, that is swollen. Those women would be encouraged to have a cesarean section. Then there are also surgeries that require concurrent abdominal operations. What do we mean here? You may find that you are pregnant, but you have fibroids. You have fibroids and they are very big. They require surgery, okay? Because there are women, we've seen women who conceive with fibroids. But at the end of the day, these fibroids have to be removed. You have a big mass in the uterus. You have a big mass in the abdomen and it has to be removed. So at times we discuss with you that as you're planning to deliver, we can do a cesarean section so that we take out the baby, number one, and two, we still go on and carry out that procedure. So that is called doing a cesarean section because someone has a pathology that requires concurrent abdominal surgery. Then there is what we call perimortem cesarean section. Perimortem cesarean section. Perimortem cesarean section, we mean the near death, like the woman is distressed to an extent that the woman is likely to die. All the fetus may also die. So what we do this cesarean section in order to improve, to try and see if we can improve the life of the mother and the life of this baby. Then we also have what we call multiple pregnancy, and this is one of the major indications of doing a cesarean section. That is where it originates from the maternal side. So If someone has multiple pregnancy, or for example, they have triplets or quadruplets, then a cesarean section may be indicated in this case. Then let's also look at the uterine abnormalities. Which abnormalities of the uterus can force us to go in for cesarean section? We can have the abnormal placenta presentation. For example, placenta previa. I've discussed about this condition before. Placenta previa is a condition whereby the placenta presents in front of the fetus. In other words, because naturally, when you are pregnant, if someone gets his fingers and passes them through the cervix, the first thing we should be able to reach at is the fetus, either the head or the buttock. But in this case, you find that the first thing you touch is the placenta. So the placenta has fallen down or has come nearer the cervical region. That is called placenta previa. So that delivery will be very difficult, and it requires a cesarean section. Then there is also what they call abruptio placenta or placenta abruption. Placenta abruption is when the placenta separates itself from the uterus. It breaks away. That will also require cesarean section because it will cause bleeding, etc., etc., etc. Now, there is what we call prior classical hysterectomy. Prior classical hysterectomy. By classical hysterectomy, we mean that you had a prior surgery that required cutting or making a hole into the uterus. In other words, you had a prior full thickness uterine surgery. Okay? If you had a prior uterine surgery, then that will be an indication of doing a cesarean section. And also now in these prior surgeries, we can also put in something like a full thickness myomectomy. For example, you had a fibroid surgery. It was a big fibroid, and they did a full thickness myomectomy. Then that will require you to do a cesarean section, and that is a uterine condition. Another condition is an invasive cervical cancer. Invasive cancer of the cervix. A woman is pregnant but is having cervical cancer that has evaded even the nearby structures. It has evaded the bladder. It has, it has metastasized. It has moved to other parts of the body. That will require also to do a cesarean section. And now we have also what they call prior tracherectomy. Prior tracherectomy, today I think I've brought a lot of big words, but prior tracherectomy is a condition whereby you did a surgery, they removed the cervix and the upper part of the vagina. Those operations are there, and there are conditions that can lead to that. For example, if you had a cervical cancer, there are even some other conditions whereby they do a surgery, remove the cervix, and also remove the upper part of the vagina. Of course, that woman will not be able to deliver normally, and therefore it will require a cesarean section. Then we also have masses, okay? Masses causing genital obstruction. Masses that cause obstruction of the tract where the birth canal, okay? So I think you can now look at if you have a mass in the vulva, if you have a mass in the vagina, upper part of the vagina, if you have a mass at the cervical region, if you have that swelling, I'm talking about swellings in those regions, how will you be able to deliver normally? Therefore, we shall do a cesarean section. And then lastly, on the uterine conditions is the permanent sacrilege. Permanent sacrilege. There are some women who have a weak or incompetent cervix. A weak or an incompetent cervix. Now, if a woman has a weak or an incompetent cervix, they may give a cervical sacrilege, or what some people call the McDonald's stitch. Now, some of these stitches or some of these sacrileges are permanent. So if the sacrilege was permanent, then that woman cannot deliver normally. It will be a cesarean section delivery. Now that we've seen the indications, which conditions can avail themselves, and a doctor is forced, or you and whoever is around is forced to go in for cesarean section, then let's also pinch around, out of all those conditions, which one require emergency surgery, emergency cesarean section? Because some of them, they can be planned. For example, you know that you have you had 3 previous scars, you were operated 3 times. That one you should plan. When you're pregnant, you should plan what we call an elective cesarean section. You should plan with your doctor that at 37 weeks, I need to deliver, and then you go in for cesarean section. But there are conditions whereby you reach the hospital and you have to be rushed to the theater immediately, urgently, immediately. You can use any word. That is what we call emergency cesarean section. This is life-threatening. And this emergency cesarean section has to be carried out within 20 minutes. 20 minutes. And that's why facilities doing operations are urged to prepare, to be ready for these emergencies, because we are supposed to do them within 20 minutes. Within 20 minutes, or at least maximum, it should be within 30 minutes, the woman is already in the theater. Now, we have what we call cord prolapse. I've talked about it, cord prolapse. When the umbilical cord prolapses, falls down,